The final polymers that we're going to discuss are micelles and liposomes. So a polymeric micelle is an aggregate of surfactant molecules dispersed in a liquid colloid. So what this means is that it is composed of molecules that are surfactants, and surfactants are compounds that lower the surface tension of a liquid and at the interface of two liquids, or between a liquid and a solid. So I suppose the best examples that we have of surfactants are things like detergents, emulsifiers in food, and foaming agents. And a colloid is something that is microscopically dispersed evenly throughout another substance. So an example of a colloid would be something like milk, for example. So their structure is generally as follows, with a hydrophobic tail and a hydrophilic head, and these can be in the range of about 10 to 80 nanometers in size. As shown in the diagram on the right, they can be spherical or disc-shaped like a rod, or in some cases they can be reversed as well. So normally with the hydrophobic head, or with the hydrophobic tail and the hydrophilic head, it means it has a particular orientation when encapsulating drugs. However, that can be an advantage or disadvantage depending on what type of drug you're using, meaning it can solubilize both hydrophobic and hydrophilic compounds. For lipid-soluble drugs, it will normally associate in the core and result in non-covalent entrapment. You can vary the composition of the polymer, and this allows for the specific design depending on what you're delivering, be it a drug, a protein, or a gene. They can also be used to attach antibodies or ligands, and some of them can be made physically responsive to their environment, with particularly changes in pH, electromagnetic fields, or in temperature as well. With regards to their three-dimensional shape and what they look like, this is just showing you an example of such a three-dimensional shape, with the drug at the centre, the hydrophobic part, and then the hydrophilic tail as well. On the right hand side you can see a number of different chemicals that are considered micelle-like and can be used to polymerize and combine with drugs. In terms of their ability to carry different molecules, these can be arranged slightly differently and can be designed to suit the physicochemical properties of the drug, the disease, the site of action, or the route. The variation in the chemical structure may improve things like drug encapsulation. They may enhance their stability and also try and control the rate of drug release. So polymeric micelles have been designed to improve drug solubility, release characteristics, and to target them to particular tissues. Some of them can be designed with a hydrolysable chemical bond, and also some of them have been used with either hydrogen bonding or ionic interactions, electrostatic interactions. These might be useful in particular for encapsulating DNA. The diagram on the right shows how these different arrangements may actually look, and you can see, for example, the slightly different variations and different arrangements with things like spacer molecules being included as well, and it is possible in some situations to load more than one drug molecule to a particular micelle. So in terms of how they're actually encapsulated, this is usually done by a few different methods, either by dialysis, which involves the polymer and drug dissolved in an organic solvent, and then they're dialyzed against water, and they naturally then arrange around their phobicities or phylicities for water or for lipid. The oil-water emulsion method involves basically allowing the molecules to rearrange around the drug and then evaporating off the solvent. Other methods include freeze drying and co-solvent evaporation as well. In terms of the drug release then, I suppose it's great having a method that protects the drug or solubilizes the drug, but you also want the drug to be released once it reaches its target. And this can very much depend on the chemical structure of the micelle polymer, the physicochemical properties of the drug, and the localization of the drug in the micelles where it's actually located within the polymer. So in some cases it may require dissociation, and micellar dissociation can be done by either drug cleavage or by diffusion or exchange with free ions. So the diagram on the right shows some of these particular methods by which this can occur, and will obviously depend on the type of interaction the drug has with the micelle, whether it's ionic, hydrophobic, or whether it's chemically bonded and requires an enzyme, for example, to cleave it. So these are all the different situations outlined in the diagram on the right. The tables below show just some of the different clinical trials that have occurred with these particular formulations, and what the size of them were, what types of diseases they were used for. Again, as with most other polymers, a lot of the first clinical trials have been done on chemotherapy, and in particular drugs like cisplatin and doxorubicin have been tried in trials for solid tumours, pancreatic cancer, breast cancer, etc. The bottom table actually shows you what happens once you combine these different chemotherapeutic agents with micelles. So in each case there's 4 different chemotherapeutic agents that are used. You have the free form of the drug, and then the drug in combination with micelles. And if you take a look at various different pharmacokinetic properties, you'll see how they change with the micellar formulation. So in most cases you can see that the T1/2 is changed as a result of combination with micelles. It also increases, in most cases, the maximum concentration in the blood. It alters the volume of distribution, and it also alters the clearance as well, for the benefit of the patient. So what are the advantages and disadvantages of using micelles? Well, one of the main advantages is that it can solubilize poorly water-soluble drugs. It can improve the safety profile, in particular for chemotherapeutic drugs. It can increase their half-life, enhance their loading capacity, gives you more control over the rate of drug release. These micelles can be made responsive to pH, and also given targeted effects to different tissues. They tend to be taken up more in tumours by the EPR effect, as with other polymers we've discussed already, and they can be used in diagnostics as carriers of dyes. Their disadvantages are that there's only been a few of these particular formations that have shown any success to date. The micelle drug conjugates in some instances can be too stable and incapable of actually releasing the drug. So this is an important point to consider, that while it might be able to encapsulate the drug or get a good bonding to it, it is obviously important then to release the drug at the end once it reaches its target. Another disadvantage as well is that in some cases the polyion ones actually release the drug too prematurely and don't carry any benefit of using the micelle formulation. And finally, as with a lot of other polymers that we've discussed, the formulations can be too expensive for some patients. The final polymer that we're going to discuss is something called liposomes. And liposomes have been known about for a long time. They were discovered over 40 years ago, and they're phospholipids that form a bilayer structure in aqueous systems. So in the diagram on the right, you can see at the top you have a liposome, and on the bottom right you have a micelle. So they look quite similar to each other, except that the liposome on top is a bilayer of phospholipids, and it's spherical, self-closed structure formed by one, or in some cases several, concentric lipid bilayers with an aqueous phase inside and between the lipid layers. They're usually made of phospholipids, so things like phosphatidylcholine, for example, which are amphipathic molecules with a hydrophilic polar head and 2 hydrophobic chains or tails. They can be unilamellar or multilamellar and can vary in size from 20 nanometers to 20 micrometers, which is quite different from micelles. The drugs can be encapsulated in the aqueous core, as is shown by the letter A in the diagram on the top right, or they can be made to interact electrostatically with the bilayer or to be taken up within the bilayer, as is shown in the diagram on the top right by letter B. They can be classified a number of different ways. We have conventional liposomes, which are neutral or negatively charged and generally used for the passive targeting to cells of the mononuclear phagocytic system. Stealth liposomes can be bonded with polyethylene glycol and used to prolong the circulation times and essentially hinder the take-up by the immune system. Immunoliposomes are ones that carry antibodies that can target them to different cell types. These can be also combined with conventional or stealth liposomes for targeting purposes. Cationic liposomes are positively charged and can be used to load negatively charged DNA for vector delivery. And also you can vary the composition of the bilayer by different choices of lipids. So in terms of drug release, what actually happens? Well, the liposome can be absorbed either A-specifically or B non-specifically onto the surface of the cell. And as with our cells, they're lipid bilayers, so they can fuse within the cell membrane and then release their contents into the cytoplasm, as is shown in the diagram. So the diagram on the right shows a liposome binding and then eventually fusing at point C and releasing the contents of the drug. Alternatively, they can be taken up by endocytosis, be taken up into endosomes and lysed by lysosomes essentially, and this can result in drug release as a result. Alternatively, liposomes have been used for many different purposes, like chelation therapy. So for heavy metal poisoning, it is required to encapsulate substances like EDTA, which don't normally cross membranes, to encase them in liposomes to get them across and to treat the heavy metals. It can be used as enzyme replacement to deliver proteins or peptides. It's been used in the diagnostic imaging of tumours with targeted delivery using antibodies or ligands to tumour cells. Cosmetically, it's been used for the delivery of coenzyme Q10, which are purported to improve skin aging, and of course what we're concerned with, it's been used for the delivery of drugs. So in terms of their drug delivering properties, well, they're targeted at the site of action. They can have active ligands such as antibodies or specific ligands that can bind to receptors on tumours. They can respond physically to temperature or pH. They can improve things like absorption and biodistribution, and they can deliver the drug in their desired form rather than it being degraded metabolically by enzymes. It can also protect drug molecules and improve its stability, and because the approach is more targeted and deals with the tissue that it wants to go to, it avoids protect the body from harmful side effects of the drug. It also can give more controlled drug release and alter the release rate of these particular molecules. So just to show what this might actually look like in terms of targeting, the diagrams at the bottom show what liposomes actually look like when their surface has been modified. So you can attach specific ligands or antibodies. You can attach things like polyethylene glycol, which we've mentioned before, which shields it from the immune system and extends its half-life. You can attach labels if you want to visualize cells or dyes. You can incorporate positively charged derivatives to allow for DNA to be transported, and it can be used to transport peptides as well. So in terms of their advantages and disadvantages, well, some of the major advantages include the fact that it's biocompatible. It's a lipid bilayer. It's exactly like what we have in our own bodies and our cells. It can entrap water-soluble in the core and lipid-soluble molecules in the membrane. It can protect molecules from external conditions that degrade them. It can deliver them directly to cells or cellular compartments. The size and the charge and the surface properties of liposomes can be easily changed simply by just adding new ingredients to the lipid mixture before preparation. It can respond to changes in the environment like pH and release the drug. The cationic lymphosomes can be used for delivery of DNA. It can definitely be used to deliver vaccines because the regular liposomes are taken up by macrophages, and in this case, if you deliver an antigen which will be taken up by a macrophage, it can then present this antigen to the rest of the immune system as an MHC complex and train the B and T cells about a particular antigen. They can also be used as aerosols, and they're amenable to drying methods, so they can be used for pulmonary delivery as inhalers, for example. The major disadvantage, however, is cost, and this has been tried previously with molecules like doxorubicin. So this molecule called Doxil with doxorubicin is extremely expensive, twice the cost of a normal chemotherapeutic regime. They often lack long-term stability on the shelf, so they can be quite unstable. So this, again, physical and chemical instability. They can sometimes be eliminated rapidly from the blood if captured by macrophages, and in some cases they don't get a lot of encapsulation compared to some of the other polymer delivery methods. So in terms of what they've been used for to date, well, the table here shows what drugs have been marketed or that are in clinical trials with this particular formulation, and you can see again mostly it's chemotherapeutic drugs that have been tried out initially, but also things like estrogens, also some other molecules as well, like bupivacaine and some siRNA molecules as well, for a variety of different cancers, but also for a variety of different types of conditions as well. So finally, we've discussed both micelles and liposomes, each slightly different from each other, but each having their own advantages and disadvantages. So by the end of this, you should be able to describe not only these polymers, but also to compare them and to critically evaluate them, citing their advantages and disadvantages and how they might be useful for one indication over another.